This segment is sponsored by Dedicated Senior Medical Center.
The onset of the coronavirus in the U.S., then in Ohio, and now in Franklin County, has many people on edge. And that's why Dr. Paul Hicks, a primary physician with Dedicated Senior Medical Center, in partnership with Ohio Health, is with us today. He is going to help answer some of the frequently asked questions many of you may have. First of all, welcome, Dr. Hicks. Good to see you.
Thank you so much. So glad to be here.
Well, there is an awful lot of concern that goes without saying that people are worried about the spread of the coronavirus, of course. What would you say to people? What should people be doing right now?
Yes, you're right, Sean. That is a very good point. And if I can start with three things.
Okay.
The first being, we as your physicians at Dedicated and all of the PCPs, all of the health systems, all the health care workers, we're here for you. You're not walking this alone. The second is we can all take a deep breath.
Right.
Let it out. Try to relax and take this opportunity to prepare. Take this opportunity to get adequate food, medications, and household items so we can be at home, happy, healthy, safe.
Well, I think that's part of what people are trying to do right now. You're absolutely right. Just hole up in your own home. But if someone is experiencing symptoms, whether they're real or imagined, maybe they're hearing that these could be symptomatic of the coronavirus, what should they do in that case?
Well, the first thing that they should do, and this one's an easy one, Sean, they should call their doctor. So we do things a little differently at Dedicated Senior Medical Centers in partnership with Ohio Health. Every patient gets our cell phone number. We want them to feel connected with us so that when they get sick, they can call their doctor. More than that though, if you don't have your doctor's cell phone number, call the office. Get connected, get your questions answered. If you have a fever, a cough, some mild shortness of breath, you should call your doctor. This is an opportunity for us to further expand this trusting relationship to keep you healthy, happy, and at home. We know that the hospitals are so very busy now with some of the sickest patients. Sometimes the safest place for you is at home.
Yeah, absolutely. And if a person does need to isolate themselves in their home,
right,
what do you recommend they do? How do they do that?
Sure. So there's two types of isolation that we can think of. There's the I live alone, and I'm in a high-risk group, which is age 60 or greater, or one of the chronic medical conditions of heart disease, lung disease, kidney disease, diabetes, or other immunocompromising states. I need to isolate at home. I need medications, household items, and food to last for 2 weeks to a month, and I need to look to my community to bring those to me. I need to friends, family, trusted community resource so that I can be there at home and be safe. Now, not all of us live alone. We live in families, and as we live in families, we need to protect not just ourselves, but we need to protect them. And how do we do that? We can stay in our rooms, in our beds, sleeping alone. If possible, have our own bathroom. When we step out, we need to wear a mask to keep our loved ones safe. We need to wipe down surfaces with bactericidal wipes, including doorknobs, countertops, and we need to provide and do excellent hand hygiene, washing our hands for 20 seconds.
Great things to be reminded of. And if you are a Medicare eligible senior, reach out to Dedicated Senior Medical Center in partnership with Ohio Health for all of your health care needs. Call 614-733-5400. And we want to thank Dr. Hicks so much for helping clear up some of this confusion for us. Thank you.